got a room full here at Velma Jackson, and we're recording this for our friends at Rosa Scott, Ridgeland, and Germantown High Schools. And we just got through talking about and watching some stuff in the education and training career cluster, and just watched a video on dietitians and nutritionists. And I talked about my experience with as a bariatric and some of the things y'all do. And I'll let you talk about, talking about what it is you do. We got some great questions we're going to get to, but just introduce your career and what all it is you do.
Alrighty. Well, thanks for having me, Greg. My name is Sadé Meeks. I am a registered dietitian. And so I'm happy to tell you all about the path to getting here. Because honestly, if I'm being quite transparent, I didn't know what the path was when I knew I wanted to be a dietitian. I honestly didn't know what the path looked like. So I wish I had someone to tell me that ahead of time, but I'm glad to be here to share that. So my bachelor's of science is in culinary arts. So initially I thought I wanted to be a chef, but I still love cooking, but just doing my internships and just some of my coursework, I realized I didn't like being in the kitchen that much. Like if you're a chef, you're gonna like spend most of your life in the kitchen, and that wasn't for me, which was okay. And so because it was a bachelor's of science in culinary, I had a lot of background in sciences. So we studied food science and nutrition. We had like one course in nutrition, and that was like one of my favorite courses. And I was also in honors, so I did a lot of my honors research on nutrition related topics. So I knew I wanted to pursue that a little bit deeper. And so I wasn't even thinking grad school until my junior year of college, and that's when I decided to pursue a master's of science in nutritional science. And so there are a lot of degree programs, and I ended up going out to LA just because I have family in California. So I got my master's in nutritional science from Cal State LA. And I will say, before now, it will start in 2022, you will have to have a master's to become a dietitian. Right now, most dietitians probably have a bachelor's. Some do have a master's, but they're switching the requirements. So moving forward in 2022, the new requirement will be to have a master's. And a master doesn't have to be in nutritional science. It can be in public health. It can be in food science. It can be in anything related to food or nutrition or public health. Um, but the program that I was in was specifically nutritional science. And there are two different pathways you can go. You can get into a program that's called a coordinated program, or you can just get into a regular master's program. And I'll tell you the difference of what they look like. So I got into a coordinated program, meaning that my internship was included in my coursework. So in my master program, my last year, I had to complete 1,200 hours of an internship. However, if you're not in a coordinated program, if you're just in a regular master's program, you have to get your master's and then you have to apply separately to an internship. So it's kind of like a two-step process as opposed to the coordinated is all combined. But if you don't get into a coordinated program, you'll have to just take that extra step to apply to internships separately. Thankfully, I was in a coordinated program, so um, I was able to get my hours at the same time as I completed my master's. And so the internships were fun because that's when I really got to understand like what dietitians do. Well, not the internship, but like just the beginning. But like when I did the internship, it just made it real. But I think people have a small, I guess, perception of what dietitians do. If you haven't been exposed, some people may think they're just nutritionists that tell you to eat your fruits and vegetables, and that's part of it. That's a small part of it, but that's not it. And I will be honest, my first time meeting a dietitian was in college. And that just shows you too how there's a need for more diversity within the field as well, because there are only less than 3% of dietitians are African American. And so definitely a need for more diversity within the field too. So anyways, when I started my internship, we had to do different rotations, and so all the rotations were different. So there was a clinical rotation, which was probably one of my favorites. In the clinical rotation, you were like in a hospital, And so dietitians are in hospitals. A lot of times they are the ones recommending certain diets for patients. Especially like if they're in the ICU. That was one of the floors I worked a lot. Dietitians are responsible for figuring out calculations. So we do a lot of math. We have to calculate what type of tube feeding the patient can get based on their critical condition or their ability to really tolerate the food or the feeding. And so we have to calculate how much protein, how much fats, how much carbohydrates. And so that's what's being done in the clinical setting. And in the clinical setting, you don't get that much time with the patient because they're seeing so many people. They're seeing a dietitian, they're seeing the physical therapist, they're seeing the social workers. So you're in there like 15 minutes to see a patient, if that. And so that's the only thing I didn't like about clinical. I didn't feel like I could really, really make as much of an impact as I wanted. But that was the clinical rotation. Then you have a community rotation. For my community rotation, I was partnered with a nonprofit at a food pantry, and we worked on like cooking classes and things like that for the community. Now another rotation was a private practice, so I got to see the business side of things. Like, if you're a dietitian, you can have your own private practice, and you can see your own patients in your own office, and you can have as much time as you want, as much freedom as you want, and you can do it the way you want. So I saw the liberty of like having a private practice, and I at that time the private practice was in like close to Calabasas. So you know anything about Calabasas, that's like where the Kardashians live. Like that's where all the rich people live. So like she was seeing like really clients that were paying money. So not every that just kind of shows too. Like sometimes it can be viewed like dietitians and that service can be viewed as a luxury, which it shouldn't be. And I'll get to that. But that was another rotation. So those are just some of the jobs that you can have within the field of dietetics. So, when I got my degree, my first job in the field was as a diabetes dietitian at the public health department in Murfreesboro, Tennessee. And that's like a passion of mine, diabetes and prevention and care and management. And I learned so much about that population and grew such a passion and compassion for that population. And one thing I really learned to make sure patients knew is that diabetes isn't necessarily your fault. I think a lot of people place the blame on themselves if they get diagnosed with something like diabetes.
That's such a good
But
point.
yeah, yeah, and so and that having that blame can make it harder for you to want to make change because you're just kind of just stuck. You're just stuck playing the blame game. So that was something I had to really try to rewire in the patient's head. Like you can only do so much. Like food is definitely a part of it, but sometimes it's other factors playing a role in that. So I at the public health department, I saw patients who probably couldn't afford to go to a regular clinic or go have insurance. So I saw a lot of patients who, were in the low income um, um, salary range. And it was very humbling and I love that job. I got to do not only see patients one on one, I got to spend as much time as I wanted with them because if they needed it, I'll just bring them to my office. That we had a clinic like in the health department, so it was legit doctor's office. And so I would see the patient with the diabetes nurse, we'll see the patient together. But if I saw they needed more help, I could definitely just spend a little bit more time with them or schedule an additional appointment. So I saw everyone that had diabetes or pre-diabetes, they saw me. And I think that's so needed because you would be surprised how many people can go out their whole life with diabetes and never, seeing a dietitian. And that's important because food is one of the main ways you manage diabetes. So that was my main job at the health department, and I also did like community outreach, so cooking classes, prevention talks, and things like that on the weekends. So my job was on the weekends too, which I didn't mind because if I worked the weekend, I could like flex my hours during the week. So I worked that job for 2 years, and then I had a strong conviction that my time there was up, and I left that job and began to pursue my own nonprofit. So now I'm an entrepreneur, but still a dietitian and doing the things I love. My nonprofit is called Growing Resilience in the South. Incorporated. And the mission is to improve the health and well-beings of communities through an increased awareness of nutrition, food, and culture. And so my mission with Grits is to bridge that gap between nutrition and culture and show people how they intersect. You don't necessarily have to separate the two. You don't have to give up your cultural foods to be healthy. So with that, I do provide free nutrition counseling to low income patients. So, really trying to show that this service shouldn't feel like a luxury. Everyone should have access to dietitians. So, I'm working with other dietitians in the state, contracting them to provide this service. And I'm also working on a storytelling project called Food as Resistance. And this project is really showing and reclaiming what African American foods are and showing people how they can be part of their health and can help them reduce risk factors to certain diseases like diabetes. So I'm really happy to be doing this full time now. And I also do contract work for a company called Healthline. So you may be familiar if you're on the web a lot. Healthline Media is it's the number one online health publication. And so I'm a medical reviewer for that company. So I don't write the articles, but I review the content, specifically nutrition related content, to make sure that the sources are correct, that it's they're including the right research and that sort of thing. So I review all the articles before they are published. And so I also do that as a dietitian. So I love the field because you can do so much. It's not like you are in a box, and me being such a creative, I need the freedom to do all the things. So that's pretty much it. I know I covered a lot in like 10 minutes,
But
but
that's fine. You actually had a great segue from what we had just talked about, because I just mentioned how um, dietitians are a part of the medical community, but they're also part of the education community. Because, like you said, with people having diabetes, especially in Mississippi, it is so prevalent. And it's
mhm,
it's not like you see on TV. A dietitian is not just somebody the Kardashians have that a bunch of money. Uh,
yeah.
it's somebody that really has a lot of training, that really teaches people how to be more healthy. And I explained before you came on, I explained to the class when I had my bariatric surgery. Me and you've talked about this. When I had my bariatric surgery, I had several meetings with a nutritionist, and it didn't mean I was dying, and it wasn't some luxury private practice, but it was an important part of my new medical of my medical
Mhm.
procedure I was having in order to survive and get the most out of that. So I think if people want to be a part of the health science field, but like you said, we still want that freedom, a dietitian can be a good path to go.
Yeah, and I totally agree. I think people need to emphasize that more. Like, not anyone can just be a dietitian. Like, we get medical training. Like, we are in the medical field. We work with the doctors, nurses, the whole team. And that's why I take so much pride in what I do, because I had to study really hard to get here. And there's pros and cons with it being a requirement for the masters now. One con is that it's going to make the education more expensive, but I think in the long run too, it may increase our salaries, because we have this higher education too, like it's required. Our salary should eventually reflect that too. So that's another plus about that.
Yeah, and then you also talk about the diversity that's needed in the field, because only 3% of dietitians are African American, which is an just actually eye-opening stat. And how much more important is that? Because, like you said, you're serving the low income and it's kind of the underserved areas. How much has the lack of diversity in dietitians affected the health issues we've seen in those areas, not just in Mississippi,
Um,
in the South?
yeah, we see it as dietitians too. We see it at like the core level too, like major institutions like the Academy of Nutrition and Dietetics, like, or even like the food plate. We see a lot of times how recommendations are really Eurocentric focus, and like their plays don't really reflect cultural diversity. And thankfully now more dietitians are advocating for more diversity reflected in health recommendations. And I think because there's been a lack of that for so long, that's why there is a disconnect between nutrition and culture. And any minority interested in the field, I can get you connected, but I definitely highly recommend. I work closely with the founders, but Diversified Dietetics is a nonprofit organization that really works with helping minorities get into their programs, apply for their internships, have mentors and all of that. And they've been running for about 3 or 4 years, but they are really dedicated to increasing that diversity within the field. And they also just started their own internship program too. So thankfully, things are happening to kind of mitigate that low percentage number that we see.
Now, and before I get to some of these questions, I do want to talk a little bit about your college experience, because I know you went to Jim Hill High School and then you went to the W, and obviously your degree was not in dietetics. But if somebody wanted to get into that field, what would be the best college programs that you think would, especially locally, the best college programs to get into that?
I definitely think, thankfully, a bachelor's in culinary. So if you did want to pursue or start off in culinary, I think that's a great. I kind of just it kind of happened by like accident, but it was a great path because a lot of dietitians don't have that skill set of food and cooking that and they lack. But I still was able to get a lot of my prerequisites in the culinary field in because it was a bachelor's, so I had like organic chemistry already. Because you do when you get into that master's, you are going to have to take another organic biochemistry. You're going to take a lot of different chemistry. So any major that has a science, I would say is a good route because if you plan to do nutritional science. But like I said, you can get a master's in public health and get and become a dietitian. So if it's not a science related major, anything in the health field I think would be a good like start to your master's program.
And that's crazy that I've never met a single, and this is unbelievable. I've never met a single person that went to the W that has said anything but positive things about their experience there. I think that is a hidden gem about some great things going on up there in Columbus.
Yeah, I was very involved in MUW. I was SGA president
Oh wow.
there, and I was in Miss MUW as well. So I love the W.
And it's great. I mean, every person I've met, black, white, everybody has just said nothing but
Yeah.
great things about the atmosphere on campus there. And I really think, our student, we've had a few, actually our valedictorian from 2 years ago is a student there now. And
Oh, really?
we've had a few go there, and hopefully anybody watching this later will consider the W if you're interested in some of these fields, because the W is a great atmosphere for learning of all sorts. But I do have
Very.
some questions I want to get to, and these are all ninth graders, and some of these are
Okay.
really, really good. This is Jada Green, and she asked, how can I avoid foods that cause me to have uncomfortable symptoms?"
Um, well, it really just depends on what the symptoms are. So I would definitely it's hard for me to answer that question because I don't know what the symptoms are, but I would definitely recommend connecting with a dietitian or nutritionist. You could get her my contact. But usually that's where it starts. Like you have to identify the symptoms because certain foods are known for causing symptoms. For instance, lactose is gonna, if you're sensitive to lactose, you're gonna have, maybe bloating and diarrhea. So understanding what the symptoms are can really help me maybe um understand what foods may be causing the symptoms. So have to start with the symptoms and work our way up.
Yeah, because I think a lot of time, and I know it's happened to some pro athletes. You could have a food allergy and not even know it.
Yeah, yeah. Hmm.
This is Travarius Carson, and he asked, "Well, we already know you love what you do." He does ask that, but he said, when you're doing your job, do you feel like it puts your mind at ease?"
Um, for the most part, I'm not gonna, I think with every job you're gonna do tasks that aren't, the most fun. But at the end of the day, I'm at ease because I know I'm doing exactly what I want to do. So it doesn't matter, how the process may be at times. At the end of the day, I am at ease. So I think that's the most important thing.
Yeah, and it's obvious you're really passionate about it. This is Xavier Jackson, and he asked, "How do you build rapport with your clients?"
That's a very good question, and that's a very important step. Like you can't skip that step because a patient is not gonna like be receptive to what you're saying if you don't. So I think the first 10 minutes, at least, if you have that time, depending on the setting you're in, you should be getting to know the patient and not making it about you or what you do or, telling them what to do. Like understanding their environment because their environment plays a role in how they access foods. Understanding their relationship with food. Do they have an experience with, binge eating or something like that? Understanding what their dislikes and likes are, because you don't want to start recommending stuff that they hate, So really getting to know them and making the first 10 minutes about them and not about what you do or recommendations, I think is very important.
Yeah, and I think that would be in any type of field that had deals with anything with anything that has patient care. That
Mhm.
rapport is extremely important because you can be the most knowledgeable person in your field, but the patient has to trust you.
Yeah.
That would be in any type of clinical setting. This is Jacayla Page, and she asked, if you're dealing with a senior citizen, how do you get them to be aware of their diet?
I work with senior citizens a lot. I actually like that population. And I was surprised because senior citizens, sometimes you think, oh, they don't care, they just living their best life, they retire, but they are really like probably the most receptive patients I've worked with, and it's probably the easiest to work with them, to be honest,
Really?
which
Wow.
is surprising. So I really don't have trouble with the old. It's the 30s and 40, the mid age.
This is Selena Johnson, and she asked, how regularly do you think people should go on a diet?
I don't. I'm an anti-diet dietitian, which just sounds ironic. I don't believe in like diet culture. I believe in like more lifestyle changes, and
Yeah.
just really listening to your body. I really teach like honoring what your body is feeling. If your body is feeling, hungry, eat. If your body's feeling full, don't stuff yourself. And practice balance. Like I think if you start like on a regimen of eating vegetables with every meal, if you start that, your body will know when you need it. Because if you stop it, your body will be like, So listen to that. Like your body knows when you're eating too much fast food. So just honor it in that way. But I definitely think structure is important in the beginning to kind of teach your body what it needs. But after that, just begin to listen to it. Know to set boundaries for yourself and just live a lifestyle like that.
As somebody on a specialized diet, I agree 100%. Yeah, I haven't had a soda in over 4 years, and it's just my body's become used to it. I don't crave it or
Yeah.
anything anymore. This is Jakaya Fields, and she asked, "What are the best sources of protein?"
Um, That's a good question. So you can get plant-based proteins and you can get meat proteins, and meats aren't, unhealthy. Certain meats will contain more like what we call saturated fats, which can be harmful to your heart. So proteins that are going to be low in saturated fat are going to include fish, turkey, um, those lean meats, chicken breast, different parts of the chicken. Then you have some plant-based proteins. Quinoa is one of my favorite plant-based protein because it's a complete protein. A lot of plant-based proteins are what we call incomplete proteins, meaning you're not going to get all the amino acids or the nutrients you need from it. So if you choose a plant-based protein, try to choose complete proteins. Eggs are another good source of protein as
Yeah,
well.
that's one of my favorite. This is Jamarquez Davis, and he asked, "What other excuse me, what other professional goals do you have as a dietitian?"
Oh, that's a good question. Yeah, I'm a dietitian, but like I'm a creative too, and I do. One of my goals is to really. I'm working on something right now, but have my own Netflix series, and but related to nutrition and cooking, but just making it fun. Netflix has been a huge like spot for like just learning and documentaries and stuff these days. But yeah, that's my long term goal. See me on the big screen somewhere, talking about what I love.
That's a good. This is Anaya Truss, and she asked, "What is the favorite diet that you put clients on?"
Um, like I said, I don't really try to put clients on a diet. I hate like doing meal plans. Like this is my worst thing to do. Because I don't want people to get that diet mentality. So my favorite thing is just to teach them how to listen to their body and what a structured meal looks like. So the easiest way to start with structure is to divide your plate in half. Fill half of your plate with non-starchy vegetables, a quarter of your plate with a grain, and a quarter of your plate with a protein. And that's kind of where I start with a lot of patients, but then we kind of, I adjust it based on their needs.
Yeah, and again, it's like you said, you have to listen to your body. Everybody's metabolism is different.
Hmm.
Everybody's stomach is a different size. Everybody has different allergies, and again, like you said, the culture also plays a huge part in that.
Hmm.
And I think that's where your career is so important in teaching people that. Now we do have like 4 people that have asked the same question,
Okay.
but this is I'll get it from Nikeria Taylor, and it's crazy that 14, 15-year-olds are asking this, but they all want to know. How much should I be eating if I want to lose, gain, or maintain weight?
Um, well, I can't tell you that that will involve a consult, but I will say that body diversity is real, and we're all not supposed to be, tiny. We're all not supposed to be large, and so I think the important question is how do you learn what a healthy body weight is for you? And I think you learn that by starting with that structure, starting with balanced meals, and letting your body and letting your body tell you what it feels the most comfortable at. I think society has portrayed this image that healthy looks one way, but it doesn't. So I really try to get people away from that weight focus mentality, because health looks differently at different sizes.
Yeah, you can't watch TV and YouTube and think that that's how everybody's supposed to look, because you can uh, you can look like them and be extremely unhealthy. I think
Right.
that's a
Yeah,
very
I used to work at an eating disorder center, so I got really exposed to that. Like, healthy doesn't necessarily mean skinny. And I'm not saying like only eating people with eating disorders are unhealthy, but people, my size who aren't, physically active and eat fast food every day, they're most likely have a high cholesterol. So I think the focus should be more of like just how do you create a balanced meal? And like I said, go back to that plate example, and then if you can work with somebody who's knowledgeable, in the area as well.
well, and we're almost out of time, and I thank you so much for joining us. But I do want to just hit on one last thing, and that is, you went to Jackson Public Schools at Jim Hill High School.
Hmm.
You went to school in Mississippi. You've been all the way out to California, Tennessee. You've been all over the country doing this, but you started right here. You grew up black in Mississippi, and you're a female, and obviously you're underrepresented in a field that's very needed right now. So you've obviously become very successful despite those obstacles. So what can these young people do now that are going to face those same obstacles? It's not a matter if, it's a matter of when. They're going to face it. How can they become as successful as someone like you has become?
Um, just really work hard and know that you can do it. Like you said, like I grew up here, Jim Hill, like Jackson, Mississippi. Like, the thing about people in Mississippi, like we have so many odds against us, but that shouldn't like be a barrier. That should be something that kind of gives you that momentum. And there's so many of us that are doing it. So I think you just have to work hard and believe in yourself, because you're not different than me. Like, we come from the same environment. So I just really think people have to believe in themselves that they can do it and work towards it.
Yeah, I agree. The sky is definitely the limit, and you can do it right here in Mississippi.
Yeah, and you can come back too. There's nothing wrong being here. I chose to come back. I could have been anywhere, but I chose to be here. And it's all about where your heart and your purpose is. So really follow that, and don't get caught up in the money, because when you do what you love, the money will come.
Absolutely. I agree 100%. That's some great stuff. And again, thank you so much for joining us. I know you're really busy, uh, and I think you're doing some great stuff, and looking forward to see what you have next on your plate for 2022.
Thank you so much. I really enjoyed
All right.
it.
I'll see you soon, my friend.
All right, bye.
Yeah.